All right, so we'll talk about trauma bypass and the role of helicopter emergency medical services in trauma. So major trauma patients have better outcomes at tertiary hospitals, especially hospitals designated as a major trauma service. In Queensland, that includes the Gold Coast Hospital, the Princess Alexandra, the Royal Brisbane, and the Townsville Hospital. There are a couple of reasons for this, but it centres largely just around experience and capability. So the ED teams, if they're routinely dealing with major trauma, they're obviously going to do a better job than if they're not. Again, surgeons who are experienced in trauma and in liaising with the ED to incorporate that red blanket protocol and get patients up to surgery quicker, patients are going to have a better outcome. And there's going to be more specialist availability at a large tertiary hospital for things like pathology, so they can get those bloods done quicker. Now, it can be valuable, and there's been better outcomes shown if the patients are transported to these hospitals, even if it means bypassing a closer, smaller hospital. So in Australia, the guidelines are 45 minutes. If you can get to a major trauma service within 45 minutes of driving, you bypass all your other hospitals. If it's more than 45 minutes, you go to your nearest regional hospital or smaller hospital and you notify comms that a transfer is going to be required, and then they can start that ball rolling. Now, some clinical judgment is required here. If you've got a regional hospital 30 minutes south or a major trauma service 1 hour north, you're going to be better off going to the major trauma service rather than driving in the exact opposite direction when the patient's then going to have to be transferred back there anyway, okay? So this is just for the 45 minutes is for when you're going to be driving past or very close to a regional hospital when it's appropriate to ignore it and just keep going. So there are different guidelines around the world and even within Australia, but they're all broadly similar. So the kind of patients who are going to benefit from going to a major trauma hospital are head injuries, less than GCS 14, patients who are hypotensive from trauma, patients who are either breathing too slow or fast from trauma, serious chest or abdominal wounds, and suspected spinal cord injuries, all of which we've seen at the World Cup in the fake trips and falls from the players. Now, helicopter emergency medical services are well established throughout the First World, but there's a disparity in data for whether they contribute to positive outcomes in trauma specifically. So there are a lot of benefits to a HEMS service. You can have a small team of highly trained people that can cover a huge area. And because the helicopter is so much faster and travels in a straight line, they can get these patients to a major trauma service more quickly. Drawbacks is that a helicopter is very expensive to run and they tend to prolong on scene time. Now, whether it's useful or not depends on a lot of other factors, and one of them is the crew mix. So whether you have a physician on the helicopter, a doctor, or a paramedic, and just as importantly, what kind of paramedic. Because a lot of what the physician can bring to a scene, things like RSI and fast scanning and blood products, an appropriately trained critical care paramedic can do as well. As a rule, having a helicopter attached to a trauma job is not value added unless the road transport time is going to be longer than 30 minutes. So while the helicopter is fast, they still need to lodge their flight plan, brief the crew, take off, fly to the scene, find a place to land. Loading the patient takes a while, longer than it takes to get someone in an ambulance. And until you're getting to more than a 30-minute driving time, you're probably just it's probably going to be quicker to just go by ground. The value starts to increase really dramatically as that 30 minutes gets expanded out. So a 90-minute transport time by road, a helicopter transport is going to do way quicker. Now, Cochrane collaboration, even the really big players in the systematic reviews, was unable to come to a conclusion in the last review that they did for whether HEMS in trauma is actually value added. There are some studies showing an improvement, some showing a worsening of outcome, and the ones where there has been improvement, it's unclear if that's just due to the advanced airway techniques that the helicopter brings or the rapid transport time. So an area of ongoing research.